At Denver's National Western Complex, people mostly over the age of 70 file in to get their first dose of Moderna's COVID-19 vaccine. For many, it can't come soon enough.
I want to see my grandchildren and hug and kiss them, and I can't.
5,000 shots will be administered on this day.
This is our way out of the pandemic, is to get everybody vaccinated.
J.P. Vallon is with SCL Health, which held this event specifically for vulnerable populations in communities of color.
We are more likely to be infected, but also more likely to be hospitalized and more likely to die.
Deirdre Johnson is with the Center for African American Health. Government statistics show that blacks and other people of color die from COVID-19 at a rate nearly 3 times that of whites. And yet a Kaiser Foundation survey of 23 states reveals blacks lag well behind the general population in getting the vaccine.
No one is running toward vaccines. We just happen to be a group that has kind of historical reasons for that distrust.
That mistrust goes way back. The infamous Tuskegee syphilis experiments and myths like blacks tolerate pain better have helped fuel African Americans' deep unease with the medical profession. Access to medical care is always an issue, and the term for the current vaccine effort, Operation Warp Speed, has also made many vaccine hesitant.
All that kind of creates a haze around making this decision. And so we're working to, as we say, kind of clear that haze.
The White House COVID-19 task force has announced it will begin delivering vaccine doses to federally funded clinics in underserved areas. Community health centers in Texas are inoculating majority-minority patient populations right now.
There are a whole bunch of different strategies that we're going to need to take to be able to reach this community. There's not a one-size-fits-all solution for reaching this population.
SCL recruited patients from more than 36 organizations for its event, including one that serves the LGBTQ community.
I have never been so excited to have a stranger, stick me with a sharp object.
Many folks from the LGBTQ community are part of the service industry or retail workers or frontline workers, healthcare workers.
The same is true of the black community, contributing to their already above average medical risk, adding to the urgency of getting doses out, getting grandma back with grandkids, and closing the vaccine racial gap.
I'm just over the moon. I'll be able to hug him and kiss him, and I'm just looking so forward to that.